The United States has a population of 3,013,914 people, and out of that number, about 25.8 million people have diabetes. I live with my grandmother, who has had diabetes for 43 years, and I have helped take care of her through her diabetes. Anybody can be at risk of diabetes, whether it runs in your family or you're not taking care of your health the way you should. I'm going to inform you about what diabetes is, how you can prevent it, and treatments for diabetes. First, I will acquaint you with what diabetes really is. According to the American Diabetes Association, diabetes is a disease where a person's body doesn't create or accurately use insulin. Insulin is a hormone that is needed to alter glucose and other foods into energy. There are 3 types of diabetes. The first type is type 1. Type 1 diabetes happens when the pancreas discontinues creating insulin. Insulin lets glucose into the body's cells to be used for energy. When you don't have insulin, the cells don't get the glucose they require, and too much glucose forms in the blood. Type 2 diabetes is a permanent disease that occurs when the cells of the blood can't use insulin the right way, or when the pancreas can't make enough insulin. Eventually, the additional glucose in the blood can harm your eyes, heart, and other organs. The third type is gestational diabetes, which is a temporary form of insulin resistance that generally occurs midway through pregnancy as an outcome of excessive hormone creation in the body or the inability to make extra insulin that is necessary. Second, I'll talk to you about ways to prevent diabetes. There are small steps you can do to help reduce the risk of diabetes. Some minor ways are to exercise regularly, eat healthy, and don't use tobacco products. When it comes to exercising, any kind of physical activity is good for your health and also helps prevent diabetes. Some examples would be strength training, flexibility, and aerobic exercises. American Diabetes Association says that if you are trying to lose weight, aim for 30 minutes a day. Of course, eating healthy is an essential part of a healthy lifestyle, but it also helps you reduce the risk of diabetes. If you do get diagnosed with diabetes, there are different kinds of treatments for different kinds of people. First of all, you have to put in a lot of time into caring for yourself if you do get it. Controlling your blood sugar is one of the main things you have to keep track of. Using a glucose monitor can help you with keeping track of your blood sugar. Another thing you could do is take medication. Taking insulin will help maintain your sugar under control. You should also go talk to your doctor and ask what type of medication is right for you. Today I have informed you about what diabetes is and measures to prevent and treat it. Diabetes should be taken very seriously. Not taking preventive measures and not treating this disease properly could be harmful and could eventually cause death.